The final phase of implementation of the new Affordable Care Act is in place right now, and really begins with the opportunity for people to, for the first time ever, have a online shopping experience, which gives them side-by-side comparisons of plans. We'll give information to individuals about what they qualify for in terms of financial help, and then let people make good choices for themselves and their families. Nothing like this. I'm a recovering insurance commissioner. I can tell you that nothing like this has ever been available before for people who shop in the individual market or for people who have been uninsured. About 85% of the people in the country have affordable health care through their employer, or are a Medicare beneficiary, or are a member of veterans benefit programs. Nothing changes for that 85%. Their policies have gotten stronger over the last 3 years with some additional consumer protections, but they don't have to make any new choices, and you don't have to change any coverage. They already have affordable coverage that works for them. This is really for the 15% of folks, and it's 23% here in Florida, who either have no insurance at all or who don't have affordable coverage in their workplace. So something is offered, but it's just way out of reach, or have been locked out by an insurance company because of a pre-existing health condition, or priced out because of a pre-existing health condition, or lost a job and lost their coverage along the way, or are an entrepreneur starting up their new business and don't have health coverage. They have new options available, and we're hearing from people all across America about those options. So the website is up and running at healthcare.gov. We are making improvements as we speak. The first couple of days have been rockier than we would have liked. Some of that driven by this enormous flood of interest. We've had over 10 million hits on the website, and that's just the federal website. That doesn't include some big states like California and New York who are running their own programs. We've had over 500,000 calls at the call center, and we have great navigator partners on the ground dealing with people in person. So we tried to anticipate people who wanted to go on the web, people who wanted to have in-person assistance, or people who wanted the toll-free number. All are up and running. The website is a lot better today than it was yesterday. It will be a lot better very quickly. We want to make it a very smooth process. But the good news is this. This is a 26-week open enrollment period, 6 months, from October 1 till March 31st, 26 weeks. The prices don't change. They're locked in. We won't run out of product if you don't get in day one. The product will still be on the shelf in 5 months. The earliest any benefits start is January 1st. So signing up by December 15th qualifies you for the earliest possible time you can get coverage at all. So we do have some options and choices for people never there before. And finally, I just want to remind folks, and I know the mayor knows this well, we are in a state where the debate about Medicaid expansion is still underway. Without Medicaid expansion, nearly 2 million Floridians who would qualify for very low-cost insurance coverage will be still left out in the cold. They won't have any health benefits available. What we know is that Florida is looking at the possibility of having $51 billion of federal funds come into the state over 10 years to help pay for the cost of uninsured Floridians, $51 billion. And independent studies have indicated that an additional $90 billion in just economic development would be spurred by that kind of investment. Additional hires at hospitals, resources that could be redirected from Florida taxpayers into economic development or education or infrastructure projects that are currently being spent trying to pay for uncompensated care. The offer is on the table. It is fully paid for within the Health Care Act. This doesn't add a dime to the deficit. It's already paid for. And we are hopeful that the conversations here in Florida will continue about the Medicaid expansion as we move forward. Coverage, again, would start in January. But there is no timetable for that coverage. It isn't a 6-month sign-up period. It's an open offer that we hope is listened to carefully. So with that, Jody, I'll turn it back over to you with just the comment that we were thrilled with the University of South Florida navigation grant effort, because I think it's typical of navigators in various parts of the country. Jody's organization has a lot of experience with helping families understand affordable health care. They were involved in the CHIP expansion. They have done outreach in communities across Florida for years, so it became a logical expertise to tap into known community partners who are knowledgeable about how to help people work through what is sometimes complicated and confusing decisions and make good decisions for themselves and their families. So again, great to be here with you. I was here when we announced the Navigator grants in mid-August, and pleased to be back. And one final thing, Pamela Rochelle, Dr. Pamela Rochelle is here. Pamela is our regional director here in Region 4. She offices in Atlanta, although it would be hard to tell because she has taken up secondary residency here in Florida and will be on the ground a lot during this very important